Understanding anemia causes, symptoms, and solutions, the fundamentals of blood cell production. When we explore the underlying causes of anemia, we must first understand where our blood cells originate. As Dr. Morgan explains, our red blood cells are primarily produced in two vital organs. First and foremost is the bone marrow, a specialized tissue found within our bones that serves as the primary factory for blood cell creation. The second important site is the kidneys, which play a crucial role in stimulating red blood cell production through the release of erythropoietin, a hormone that signals the bone marrow to increase production when oxygen levels in the blood are low. This production system is remarkably efficient under normal circumstances. However, various conditions can disrupt this delicate process. For instance, disorders affecting the bone marrow, such as leukemia or aplastic anemia, can significantly reduce the body's ability to manufacture sufficient red blood cells. When such conditions emerge, the entire blood production chain suffers, resulting in decreased red blood cell counts and the subsequent development of anemia. Abnormal red cell formation and lifespan. The shape and structure of red blood cells are critical to their function. Healthy red blood cells resemble biconcave discs, similar to donuts with a depression in the center rather than a hole. This unique shape maximizes the surface area available for oxygen transport while allowing the cells to bend and flex as they navigate through narrow blood vessels. However, certain genetic conditions can cause red blood cells to form abnormally. In sickle cell anemia, for example, the red blood cells adopt a crescent or sickle shape instead of the normal disc configuration. Dr. Morgan emphasizes that these misshapen cells are significantly more fragile and prone to rupturing as they travel through blood vessels. This increased fragility leads to a shortened lifespan and accelerated breakdown of these cells, contributing to chronic anemia in affected individuals. Under normal circumstances, red blood cells have a lifespan of approximately 120 days, roughly 4 months, before they're naturally removed from circulation. When these cells reach the end of their life cycle, they're broken down by specialized cells in the spleen and liver. During this breakdown process, the iron contained within the hemoglobin is carefully recycled and stored for future use in producing new red blood cells. The role of kidney function in anemia. Kidney disorders represent another significant pathway to developing anemia. Dr. Morgan points out that in cases of chronic kidney disease or inflammation, the kidney's ability to produce erythropoietin becomes compromised. Without sufficient erythropoietin, the bone marrow receives inadequate stimulation to produce red blood cells, resulting in a gradual decline in red cell production and the onset of anemia. This renal-associated anemia often develops gradually as kidney function deteriorates. Patients with conditions such as glomerulonephritis, diabetic nephropathy, or polycystic kidney disease frequently develop anemia as their disease progresses. The severity of anemia typically correlates with the degree of kidney dysfunction. More advanced kidney disease generally results in more pronounced anemia. The relationship between kidney function and anemia creates a challenging clinical scenario, as treating the underlying kidney disease often becomes the primary approach to addressing this form of anemia. In many cases, therapeutic interventions may include erythropoietin-stimulating agents to compensate for the decreased natural production by the kidneys. Iron deficiency, the most common cause of anemia. While severe conditions like bone marrow disorders and kidney disease can certainly cause anemia, Dr. Morgan notes that the most frequently encountered type is iron deficiency anemia. This form develops when the body lacks sufficient iron to produce adequate hemoglobin, the protein in red blood cells responsible for carrying oxygen. To understand iron deficiency anemia, we should visualize the process of red blood cell formation. Dr. Morgan uses an elegant analogy. Think of red blood cells as tiny houses being constructed. In the bone marrow, iron represents the essential building materials, like bricks and cement, without which construction cannot proceed properly. Vitamin B12 and folic acid function as additional, critical building components. When iron stores become depleted, the body cannot construct complete red blood cells with fully functional hemoglobin. The resulting cells contain less hemoglobin and therefore carry less oxygen, leading to the classic symptoms of anemia: fatigue, weakness, pale skin, and shortness of breath during physical activity. This deficiency can develop gradually, with symptoms becoming more pronounced as iron stores continue to deplete over time. Sources of iron and how it's utilized in the body. Our body obtains iron primarily through dietary intake. Dr. Morgan highlights several excellent dietary sources of iron, including red meat, organ meats like liver, particularly rich in iron, and various leafy green vegetables. Once consumed, this iron undergoes absorption in the small intestine before entering the bloodstream. After entering circulation, iron exists in several forms within the body. In the bloodstream, it circulates bound to a protein called transferrin, measured clinically as serum iron. The body also maintains reserve iron stores, primarily in the liver, spleen, and bone marrow, which can be assessed through ferritin testing, a key diagnostic tool for evaluating iron status. Additionally, a significant portion of the body's iron is incorporated into hemoglobin within red blood cells. This system normally operates efficiently, with iron being recycled as old red blood cells break down after their 120-day lifespan. The recycled iron returns to storage or gets immediately utilized for new red cell production. However, this balanced system can be disrupted when iron is lost from the body faster than it can be replaced through dietary intake, leading to the gradual depletion of iron stores and the eventual development of iron deficiency anemia. Gender-specific causes of iron deficiency. The causes of iron deficiency often vary between men and women due to biological differences. For women, menstruation represents a significant factor in iron balance. Dr. Morgan explains that during each menstrual cycle, women lose blood and consequently iron, which must be replenished. This natural process explains why the diagnostic threshold for anemia differs between genders. Hemoglobin levels below 13.5 gdl indicate anemia in men, while for women the threshold is lower at 12.5 gdl, acknowledging their regular iron loss through menstruation. Women with particularly heavy or prolonged menstrual bleeding, menorrhagia, face an even greater risk of developing iron deficiency anemia. In these cases, monthly blood loss can significantly exceed the body's ability to restore iron through dietary intake alone. Dr. Morgan emphasizes that when evaluating female patients with symptoms of anemia, detailed questions about menstrual patterns, including duration, frequency, and heaviness of flow, form an essential part of the diagnostic process. Pregnancy represents another female-specific risk factor for iron deficiency. During pregnancy, blood volume expands significantly to support both maternal and fetal circulatory needs. Simultaneously, the developing fetus draws upon maternal iron stores for its own development, creating increased demands on the mother's iron reserves. Male-specific causes and risk factors. While women often develop iron deficiency due to menstruation or pregnancy, men typically experience iron loss through different mechanisms. Dr. Morgan identifies gastrointestinal bleeding as the most common cause of iron deficiency in male patients, particularly from conditions like peptic ulcers, gastritis, or gastrointestinal erosions. These conditions can cause chronic, slow bleeding that may not be immediately visible but gradually depletes iron stores over time. Risk factors for such gastrointestinal issues include excessive alcohol consumption, prolonged use of nonsteroidal anti-inflammatory drugs, and bacterial infections like Helicobacter pylori. Dr. Morgan points out that alcohol, particularly hard liquor, rather than beer, can also interfere with the body's ability to utilize folic acid, another essential component for healthy red blood cell production. For men experiencing unexplained iron deficiency anemia, Dr. Morgan strongly recommends a thorough evaluation of the gastrointestinal tract to identify potential bleeding sources. This approach not only addresses the anemia, but may also detect serious underlying conditions that require specific treatment beyond iron supplementation. Age-related anemia concerns. As individuals age, particularly beyond 45-50 years, the risk profile for anemia shifts significantly. Dr. Morgan emphasizes that for middle-aged and older adults, colorectal pathologies emerge as important potential causes of iron deficiency anemia. Conditions such as colorectal cancer, polyps, and inflammatory bowel diseases can result in chronic blood loss that occurs slowly enough to remain visually undetectable, but significant enough to cause progressive iron depletion. This occult, hidden bleeding presents a diagnostic challenge because patients typically don't observe any blood in their stool. Instead, the bleeding occurs microscopically, with small amounts of blood mixing with digestive contents. Over time, this consistent low-volume blood loss leads to iron deficiency and subsequent anemia. Due to this risk, Dr. Morgan recommends that patients with unexplained iron deficiency anemia, particularly those over 45 years of age, undergo testing for occult blood in stool. At our clinic, explains Dr. Morgan, why offer simple test kits for approximately $30 that allow patients to check for hidden blood in stool samples at home. These tests can provide early warning signs of colorectal issues and help guide further diagnostic procedures. Advanced diagnostic approaches. When basic laboratory tests confirm anemia but don't clearly identify the cause, more specialized investigations become necessary. Dr. Morgan discusses the importance of stool testing for occult blood as a critical step in evaluating unexplained iron deficiency anemia, particularly in older adults. These tests can detect microscopic amounts of blood in stool samples, potentially signaling gastrointestinal bleeding that isn't visible to the naked eye. For patients with positive occult blood tests or persistent unexplained anemia, endoscopic procedures offer direct visualization of the gastrointestinal tract, Colonoscopy allows examination of the entire colon and rectum, while upper endoscopy evaluates the esophagus, stomach, and upper small intestine. These procedures can identify specific bleeding sources such as ulcers, polyps, tumors, or areas of inflammation. In cases where the source remains elusive despite conventional endoscopy, Dr. Morgan may recommend video capsule endoscopy, a procedure where the patient swallows a tiny camera that captures images throughout the digestive tract. This technology allows visualization of sections of the small intestine that are difficult to reach with traditional endoscopes, potentially revealing sources of bleeding that would otherwise remain undetected. The comprehensive approach to anemia. While we've explored numerous potential causes of anemia, Dr. Morgan emphasizes that developing a systematic approach to diagnosis remains essential. Though conditions affecting bone marrow function, red cell structure, and kidney health can certainly lead to anemia, the most prevalent form encountered in clinical practice continues to be iron deficiency anemia, which requires identifying and addressing the underlying cause of iron loss or inadequate intake. Effective management of anemia extends beyond simply prescribing iron supplements or other treatments. It requires a thorough investigation to determine the fundamental cause. For women, this often involves evaluating menstrual patterns and reproductive health. For men, the focus typically shifts toward identifying potential gastrointestinal bleeding sources. And for older adults of both genders, screening for colorectal pathologies becomes particularly important. Dr. Morgan stresses that treating symptoms without addressing the underlying cause represents incomplete care. By identifying and resolving the primary issue, whether it's heavy menstrual bleeding, a peptic ulcer, or colorectal polyps, clinicians can not only resolve the anemia, but potentially prevent more serious health consequences that might otherwise develop if these conditions remained undetected. Prevention and maintenance strategies beyond understanding the causes and diagnostic approaches for anemia. Dr. Morgan outlines several strategies for prevention and maintenance of healthy hemoglobin levels. For individuals at risk of iron deficiency, dietary adjustments represent a frontline approach. Increasing consumption of iron-rich foods such as lean red meat, spinach, lentils, and fortified cereals can help maintain adequate iron stores. Those with increased iron needs, such as menstruating women, pregnant women, or individuals with known malabsorption issues, may benefit from prophylactic iron supplementation under medical supervision. Dr. Morgan cautions, however, that iron supplements should not be taken indiscriminately, as excessive iron can cause gastrointestinal discomfort and in rare cases lead to iron overload conditions. Regular health screenings also play a crucial role in anemia prevention, particularly for at-risk populations. Complete blood count (CBC) tests during routine physical examinations can identify declining hemoglobin levels before symptoms become severe. For adults over 50, regular colorectal cancer screening, which may include occult blood testing, serves the dual purpose of cancer prevention and anemia detection. Prevention is always preferable to treatment, Dr. Morgan concludes. By maintaining awareness of your risk factors and engaging in appropriate preventive measures, many cases of anemia can be avoided entirely or caught at early, easily treatable stages.